Okay, we're now recording. All right. So, as we get started, I wanted to, for those of you who aren't familiar with the Urban Indian Health Institute, it is a division of the Seattle Indian Health Board here in Seattle, and SIHB is one of the 34 urban Indian health organizations in the U.S., and Seattle Indian Health Board is a full-service community clinic. The mission of the UIHI is to support the health and well-being of urban Indian communities through information, scientific inquiry, and technology. And the Weaving Project, which is hosting this webinar today, is one of the UIHI's projects. So for those of you who are not already familiar with our Weaving Project, our tagline, I guess you would say, is Weaving Resources for Urban Indian Women's Wellness. And the project has been going on since about 2007 through a cooperative agreement with the CDC and the UIHI. And we provide technical assistance to 34 UIHO urban Indian health organizations and 19 state breast and cervical I get lost on these acronyms every time.
The National Breast and Cervical Cancer Early Detection Program.
Yes, thank you, Jessie. So the goals of the Weaving Project overall are increasing breast and cervical cancer screening among urban American Indian Alaska Native women, to increase our access to quality and timely, culturally appropriate diagnosis and treatment services, to support the collaborative partnerships between the urban Indian health organizations and their states, and to create a framework for future collaborations. A lot of what we do is provide technical assistance, and there's a range of those types of TA that we do, including these webinars. We have a Weaving Project website, and there are several resources that have been developed and delivered to the UIHO as a result of this project. Today, we, in addition to our main audience, which is the UIHOs and the breast and cervical cancer early detection programs in the 19 states, we've also invited participants from all the state comprehensive cancer control programs in the states where there are UIHO. So are there any questions about the Weaving Project before we move on to the main objective and the speaking portion of the guest speakers portion of the webinar? All right. So our goals today are to familiarize everyone with the CDC's National Comprehensive Cancer Control Program, and then to also get a view into a state program by having Ginny tell us about Montana's Comprehensive Cancer Control Program, and she's going to profile some successful American Indian partnerships, discuss some lessons learned, and talk about opportunities for involving UIHOs in the state programs. So our first speaker today will be Ann Larkin, and she is the team lead at the CDC's Division of the Cancer Prevention and Control Comprehensive Cancer Control Branch. And I'm going to, we're going to let Ann start her presentation. So Ann?
Thank you. Hello, everyone. My name is Ann Larkin, and I would like to start off by thanking Meg and Jessie for allowing me to speak with you today. Okay, next slide. Today, we will cover the concept of comprehensive cancer control, the National Comprehensive Cancer Control Program funded by CDC, examples of comprehensive cancer control in action, and lastly, next steps are what's new within the national program. Next slide, please. If you go to the NCCCP website, this is the definition you will find. Comprehensive cancer control is a collaborative process through which a community and its partners pool resources to reduce the burden of cancer. These combined efforts help to 1. Reduce cancer risk or focus on prevention, 2. Help to find cancer earlier when the chances of survival are better, and this is also referred to as early detection, 3. Improve treatments for cancer and hope that survival increases and side effects decrease. And 4, increase the number of people who survive and the length of time they survive by addressing the unique physical, mental, and emotional needs of what I like to call cancer warriors. Okay, the 4 things, prevention, early detection, treatment, and survivorship, that CCC does is great, but what do we really mean when we speak about the collaborative process? I wrap my mind around the concept of CCC by equating it with planning a community meal or a family get-together. If your family community is like mine, everyone has their specialty or unique dish for which they are known. I don't want to brag, but I bake a mean peach cobbler. My brother-in-law grills like no one else, and my sister-in-law makes the best margaritas. It's the same with the Cancer Coalition or partnership. There will be members that bring very specific expertise and or resources to the table. There will be clinicians that can speak to diagnosis, treatment, and new technologies. Community leaders that will know who in their community has been impacted by cancer, how to reach their neighbors, and what will motivate them to seek screening. Politicians that can carry the message of need to the state, tribe, or territory government. Religious leaders, business owners, cancer warriors, teachers, media folks, academia, entertainers, or local celebrity. You get the gist. For a cancer coalition to be successful, all sectors of cancer control need to be involved, active members, each bringing their unique resource to the table. Okay, so why a cancer plan? Why is it needed? Think of the last group or community meal you attended. What would have happened if there wasn't a menu and or sign-up sheet and everyone just brought what they felt was needed? You may have had 10 desserts, 1 vegetable, and no meats, or plenty of plates and no forks. The Cancer Coalition looks at the cancer data within their state, tribe, or territory and identifies needs. Where cancer rates are high, what type of cancer occurs the most, and what communities are most in need. The coalition then prioritize what needs to be addressed and identifies methods, strategies for addressing these needs. All of this information is placed within the cancer plan. Work groups, committees, task force are formed by the coalition and staffed by the coalition members. By using the cancer plan, the coalition can ensure that duplication of efforts isn't taking place in one area while another area is receiving no attention. All right, we have discussed the concept of CCC. Let's move on to our second topic, the National Comprehensive Cancer Control Program. In 1998, CDC established the National Comprehensive Cancer Control Program, which provides seed money and technical support for the development and implementation of comprehensive cancer control plans. The funding does not pay for direct services such as cancer screenings or treatment. Instead, it supports building the infrastructure of CCC, mobilizing support, assessing the cancer burden, identifying the most effective means to prevent cancer from occurring, and the best way to combat cancer once it has occurred. In addition, the funding helps coalitions plan their next move by supporting evaluation of implemented strategies to determine what works and what doesn't. Programs were also able to apply for additional funding to assist with implementation strategies to address colorectal, ovarian, prostate, and skin cancers. Currently, there are 16 programs that receive funding for colorectal, 7 for ovarian, 10 for prostate, and 9 for skin. Next slide, please. Since 1998, the number of programs receiving CCC funding has grown from 6 to 65. This includes, in alpha order, the District of Columbia, 7 Pacific Island jurisdictions, all 50 states, and 7 tribes and tribal organizations. Would you like to see a map? I just happened to bring one. Okay, as you can see, all 50 states are funded and 7 Pacific Island jurisdictions, 4 tribal organizations are consortiums, and 3 standalone tribes are reservations. I'm a West Coast girl, so I'm going to be biased. I'm going to start on the west. Very far west, you'll see that there's the Alaska Native Tribal Health Consortium. Going up the west coast, we have the Northwest Portland Area Indian Health Board and South Puget Intertribal Planning Agency. Going towards the center, we have the Great Plains Tribal Chairman's Health Board. Those are the 4 agencies or consortium. As far as tribes, I'm sorry, my screen just blacked off for a second. It's back on. As far as standalone tribes, we have Tohono O'odham Nation, Cherokee Nation, and the Fond du Lac Reservation. All right, so far we have discussed and defined the concept of CDC. We have gone over a brief overview of the National CCC program, including whom is funded. Now let's take a look at examples of CCC in action. Following the flow of a cancer continuum, we will start with an example of cancer prevention. This example comes from the Cherokee Nation. During their holiday health fair, Cherokee Nation hosted the Super Colon. The Super Colon is an inflatable 20-foot-long, 8-foot-high replica of a human colon. As you walk through the colon, there are interactive stations that teach you about colorectal cancer and how to prevent it. To help visitors remember important facts about colon cancer, the Cherokee Nation had visitors take a pre- and post-test. The post-tests were placed in a box to be drawn for door prizes. The Super Colon was such a success that although only 94 visitors registered for the tour, about 235 people toured the Super Colon. The Prevent Cancer Foundation that is actually quoted on this slide is the owner of the Super Colon. Interested communities and agencies can reserve the Super Colon for a health event by signing up on the Prevent Cancer Foundation's website. I apologize for not having a picture of the Super Colon, but if you have never seen it, I encourage you to go to Prevent Cancer Foundation and take a look. Next slide, please. Let's look at 2 successful partnerships of the Fond du Lac Comprehensive Cancer Program that focuses on early detection. In 2007, the Fond du Lac Comprehensive Cancer Control Program successfully implemented a partnership with the state of Minnesota via the SAGE Minnesota Breast and Cervical Cancer Screening Program. 2008 through 2009 data show that 163 mammograms and 146 PAPs were received by Fond du Lac women. Through this effort, 1 woman was diagnosed with breast cancer. Another partnership is with the American Cancer Society. The Fond du Lac Public Health Nursing Department's cancer outreach worker provides one-to-one breast cancer education through the American Cancer Society's Circle of Life Plus program and the friend-to-friend and through friend-to-friend parties. Next slide, please. Moving on to treatment, we have an example from Arizona. In 2008, the Colon Cancer Alliance launched a series of 5K walk runs, each called an Undy 5000. Participants in an Undy 5000 are encouraged to draw attention to their bottoms and colorectal cancer by running or walking in their underwear. Yes, their underwear. These events are designed to draw media attention, give survivors and caregivers a voice, and get people talking about colorectal cancer while raising funds for work in this area. Next slide, please. Our last example is from the Alaska Native Tribal Health Consortium and focuses on survivorship. This is taking straight from the success story that was submitted by this program. When cancer strikes a program, it touches everyone. When a family member dies, few resources are available to help children understand and process their feelings of loss and grief. Alaska Native children living in small, remote Alaskan villages, reachable only by airplane, not have access to cancer support resources generally available in large urban settings. In addition, few cancer support programs for children incorporate Alaska Native cultural values. Recognizing this need, the Alaska Native Tribal Health Consortium modeled the format of an existing grief camp for children and made culturally appropriate adaptations to meet the needs of Alaska Native children and families. 20 Alaska Native children, 10 boys, 10 girls attended the first Camp Coho held in Anchorage on March 31st, 2007. Each child was paired up for the day with a big buddy who also lost a loved one. The big buddy provided one-on-one support to the camper throughout the day's activities. Campers completed a post-camp evaluation. In response to one question, what is the most important thing you learned today? 75% of the campers indicated that they had learned, I am not alone. It is okay to cry. It is okay to talk about my emotions. Next slide, please. These examples and 19 other stories of success can be found on the NCCP website, and the 2011 Success Story publication will be available this winter. Next slide, please. For the sake of time, I will briefly touch on two new CDC-driven activities initiatives within the National CCC program. Please know that there are many more new activities, initiatives, and I encourage those who are interested to visit our website. In 2010, CDC developed 6 priorities for the national program. We developed these priorities because we felt that we could improve effectiveness by identifying areas and conditions with the largest health benefit and best return on prevention investments, and that by generating new knowledge means asking the right question and answering them in a way that will give everyone the information that is needed. We also felt that by working more strategically with others means determining what interests are best aligned and synergies and how synergies can best be achieved. So we developed priorities for the CDC-funded CCC activities that build on the success of the national program and the long-standing focus areas that place an emphasis on measurable outcomes, the value of efforts, and looks for the highest impact, and, of course, that resonate with the Cancer Continuum framework. The standalone priorities are emphasize primary prevention of cancer, support early detection and treatment activities, and address public health needs of cancer survivors. The 3 cross-cutting priorities are implement policy, systems, and environmental changes to guide sustainable cancer control, promote health equity as it relates to cancer control, and lastly, demonstrate outcomes through evaluation. Next slide, please. The second new development that I'll touch on is a new funding opportunity announcement that was launched last year. And the name of this announcement is Demonstrating the Capacity of Comprehensive Cancer Control Programs to Implement Policy and Environmental Cancer Control Intervention. This announcement is for 5 years, and it's designed for national CCC programs to demonstrate the enhancement and expansion of an existing recipient activity, which is to affect policy change. It is our hope that through the development and implementation of a focused policy agenda with the goal of implementing 3 to 5 policy activities, that this will advance the national program's cancer control efforts through decreased tobacco use, increased physical activity, healthier diets, increased access of screening tests, improved screening for cancer survivors to reduce the risk of reoccurrent or new cancers, and improved delivery of high-quality cancer services. Next slide, please. Real quickly, these are the 13 programs that successfully competed for that funding opportunity announcement. Next slide, please. And I would just like to say thank you for allowing me to speak, and hopefully I did not go over my time.
Thank you very much, Ann. I think we're doing very well on time. We will go ahead and now have our next speaker, Ginny Furshong at the Montana State Comprehensive Cancer Control Program, present. And so bear with us. We'll just have a few seconds of changing slides.
Can you guys hear me? It's Ginny.
Yes, we can hear you.
Okay, good.
So
I just want to make sure I took my phone off mute.
Yeah.
And then change her permission.
First?
Yeah.
Okay. Let's see. Make presenter. Oh, that's not what I want to do. Where is she? Oops, there she is. Okay, Ginny, you have the ball. You're the presenter.
Okay, can you guys see that okay?
Yep.
Yes, perfect.
All right, super. Okay, I'm going to get going. Good morning. My name is Ginny Furshong. I manage the Comprehensive Cancer Control Program here in Montana. I'd like to thank Jesse and Megan at the Urban Indian Health Institute for inviting me to participate in this webinar. It's a great honor. Let's see. Okay. Today I'm going to talk about our program in Montana, our successes with working with our American Indian partners, and our lessons learned. The Montana Department of Public Health and Human Services houses our cancer control programs, and they include the Montana Central Tumor Registry, and that registry provides cancer data and surveillance. They describe the cancer burden in Montana and produce surveillance reports that are designed to educate the public and providers about cancer disease in Montana. The Montana Cancer Screening Program is a direct clinical breast, cervical, and colorectal cancer screening program for high-risk, low-income, and uninsured Montanans. And then finally, the Montana Comprehensive Cancer Control Program is the program that I oversee, and it really looks, it builds on what Ann Larkin talked about. We look simultaneously at the full spectrum of cancer across organ sites like lung, stomach, skin, and across risk factors, so like tobacco use, age. We look across the disease continuum from prevention to end of life. We look across public health and medical practice functions, and then, of course, across communities, because we all know that cancer isn't selective. As the Comprehensive Cancer Control Program, we work with state partners that make up the Montana Cancer Control Coalition. The coalition works to implement activities from our statewide Comprehensive Cancer Control Plan. The plan was developed by the coalition members, and they work in groups to develop yearly work plans to accomplish tasks outlined within the plan. We also have contractors and local health departments. The contractors work in multi-county regions so we can provide services statewide. They work with local coalitions and partners on cancer control activities. Here is a simple map of Montana. To drive the distance across Montana east to west is the same distance as driving from Washington, D.C. to Chicago. We are a large state geographically, but we are a small state population-wise. We have just about 1 million people living in Montana. We're described as a frontier state. Here's a little interesting fact that there are 3 cows to every 1 person in Montana. And for the record, I just want to go on the record saying that I do not own a cow, although I like to eat them. We have 7 reservations and 13 different tribes that live in Montana, and the reservation areas are represented on the map in kind of that bluish-green color. The blue towns with the stars by them are on this map are where our contractor locations are. So again, these contractors have relationships with the tribal entities in their regions as well, and many of the sites subcontract with American Indian people to assist with outreach efforts. I'd also like to point out that we have contractors in all the cities where there are urban Indian health organizations. So for instance, we have 5 in Montana, in Missoula, Butte, Helena, Great Falls, and Billings. All right, there are several pieces in place that help us to be successful with our American Indian partnerships. One is that we have created a position on staff here in the program to assist with the relationship building between American Indian and the Department of Public Health and Human Services. This position was created initially to assist with increasing the number of American Indian women who access breast and cervical screening services. Now the position works in a more comprehensive approach, working across the state with urban and reservation communities, working with men and women, and working on many cancer-related topics from prevention to end-of-life care. I'm trying to pull up a picture. Aw, this is a picture of an opening gathering at a conference that our outreach coordinator, Victoria Auger, who's on the phone today, she organized this on the Fort Peck Indian Reservation in 2010. Victoria works to ensure successful relationships with tribal organizations, urban Indian centers, the Indian Health Service, the Montana-Wyoming Tribal Leaders Council, and with individual American Indian people across the state, and she really helps to bridge the gap between the 2 cultures. Another effort that has been successful is the Montana American Indian Women's Health Coalition. This group was formed in 2001 as part of the Montana American Indian Screening Initiative. The MAWAC was developed with the purpose of assisting the state program with increasing breast and cervical cancer screening rates among American Indian women in Montana, both on and off the reservations. The focus of the group was broadened beyond breast and cervical cancer to prevention, screening, treatment, and survivorship of cancer. For the first time this year, the screening program screened the most American Indian women ever in the history of the program. And the MAWAC involvement with this program, assisted with these outreach efforts, had helped us to achieve this success. And this is the MAWAC logo that the women So the program supports the MAWAC to meet twice a year. The ladies develop a 5-year plan and then conduct activities locally to meet the goals of the The MAWAC developed a quilt a number of years ago to use for outreach and to demonstrate the involvement of the different tribes in Montana. This has been very successful. And there's a nice picture of some women with the quilt. The remaining two specific activities to engage American Indian partners are contract activities and digital storytelling activities. We have contracted with an American Indian organization to provide Cancer 101 trainings targeting ultra-rural communities and American Indian people. Training objectives include educating participants on cancer safety and building skills of participants to engage community members in local cancer prevention and control activities. This is a picture of a men's health education session at an outreach event on Northern Cheyenne Reservation. Over 100 participants attended, with 38 of them being men. This is a huge success. The contractor has implemented activities specifically targeted at American Indian men to engage them into cancer control activities. Okay, the digital storytelling workshops provide training opportunities for people to learn about computer technology while telling their story. We've partnered with many tribal programs to bring these trainings to communities in an effort to address the health of American Indian people in a holistic manner. The cancer-specific stories are then used for outreach in the communities in a way that the storyteller approves. An example is having stories played on TVs in medical clinic waiting rooms while patients wait for their appointments. And these stories, here's a picture of one of the workshops. These stories are very personal and deal with all the different cancer topics, from prevention to survivorship, screening. And one more picture of one of our great workshops. Okay, so we've learned a couple of things. You know, having an American Indian person on staff within our program to assist with building and sustaining relationships has really been key. So we're very thankful right now Victoria Auger is the person that fills that role. And then the second lesson that I would say we've learned is that certainly having a grassroots level group of women that are involved in the communities is really essential and has helped with our outreach efforts in the communities. We see many opportunities for urban Indian health organizations to get involved with cancer control programs. One way would be to get involved with the cancer control coalitions statewide or locally. This looks different across the country, but each state has a group of volunteers to work on cancer control activities. And as you saw in Ann's presentation, every state has a program and a coalition, and then the tribal organizations all have coalitions to get involved with as well. So if you're located in one of those areas, you would have several opportunities to get involved with local groups. Also, there are many outreach and community events to educate about prevention and early detection of cancer. If you have ideas, there may be for any of these kinds of events, and Ann had talked about several of those in the success stories. You know, there could be resources in your state to provide these opportunities. Certainly, we are able to, at the state health department, able to assist outreach and education events through our contractors. We are able to provide mini grants out for the MAWAC women so that it can help to support and relieve some of the burden from some of the events that they put together. And then Victoria works hard on looking for other grant opportunities and other funding opportunities, and has found some opportunities. That's the next slide. The next bullet here is what I was going to talk about, is that there are American Indian specific education and training opportunities provided nationwide and locally. So what I was saying is Victoria has been able to find some of those training opportunities, and several of our American Indian partners have been able to travel and attend those trainings out of state. which has been really helpful. But there have also been opportunities in-state through some of our partner organizations that they can attend. There are several American Indian Alaska Native comprehensive cancer control programs that Ann talked about, funded through CDC, and they have developed trainings and educational materials specifically for American Indian Alaska Native people. And like Spirit of Eagles is one that pops into my head first, and there are several others like the Urban Indian Health Organization and this weaving project and program, and being able to have these webinars is extremely helpful. The last area that seems to be like an opportunity for involvement would be the digital storytelling workshops. We have had a great response to these workshops, not only in the cancer control area, but other programs too. The traffic safety, car seat programs. There were people, I'm trying to think of some of the others. Victoria could speak to this better than I could, but other programs in the tribal communities that have wanted to get involved and have somebody to tell a story so they can use it for their outreach and education efforts as well. So we've partnered with them to put these workshops on so that it really helps the Indian community in a more holistic way, that we're not just going in and saying we're just all about cancer, but let's look at all the health issues in the community and work together to provide some education and outreach messaging. If that is something that you would like to get involved in or hear more about these digital storytelling workshops, we have contacts that can provide that training for you. So I'd like to thank you for listening to me speak today. If you have any questions, I'd be happy to answer them. Victoria is on the phone as well, and I put her contact information up here. She is extremely competent and willing to help with any outreach and education events that you may just want to have some more ideas or discuss and hear what we do in Montana. So feel free to contact her. Thank you.
Thank you very much, Ginny and Victoria, for being on the call as well. I think I'm going to go ahead and take back the presentation. Let's see here.
Do I have to do something?
No, I can do it.
Okay.
All right. Thank you again, both Ann and Ginny, for presenting such great information for our audience. We'd like to open it up now to any of the participants who would like to ask a question or have a comment or share a story about any of their experiences. Does anyone have anything to ask? And there's also a chat feature if you don't want to speak out. You can type it into your in the little box at the bottom right-hand side and type in your question, and we can read it out. Okay. Well. Oh, go ahead.
This is Kendra in Arizona.
Hi, Kendra.
Hi. I could just talk briefly about a collaborative effort that's actually going to start on August 30th. It's our 5th annual conference for enhancing tribal. It's with the Breast and Cervical Early Detection Program collaborations. And it's a collaborative effort between a lot of different entities, our cancer registry, the cancer program, Susan G. Komen for the Cure, and like I said, this is our 5th annual event, and it's a wonderful. It's a 2-day workshop, and we do a lot of talking about current issues. For example, we're going to be talking about tobacco. Each of the programs do an update for their successes for the past year. We're doing some clinical presentations on colorectal cancer. And the Comp Cancer program is doing an update on their program as well. So it's just a very interesting day. CDC is going to be here with us, attending that conference, so we're just real excited.
That's great. Thank you.
Yes.
Thanks, Kendra.
What was the date of that again, Kendra?
It's August 30th and 31st. It's going to be in Flagstaff, Arizona.
Great. Thank you.
Yes. And we're also talking about survivorship, so trying to hit all the CDC priorities.
Right. That's fantastic.
That's great. Anyone else?
We apologize for the background beeping. I don't know if everyone, can you hear us okay over that?
Yes.
Okay.
All right. Well, maybe we'll just go on and wrap up our presentation here today. We wanted to invite you to our next webinar in the summer-fall series. It will be September 7th at 10 a.m. Pacific time, and the topic is going to cover the Susan G. Komen for the Cure's community profiles. The Komen community profiles are developed by the local Komen affiliate offices, and they're a helpful resource for breast cancer information in the local area. These resources can then be used by organizations locally to inform their grant writing or program development or program planning as well. We're going to have 2 speakers for that webinar. Nadine Barrett from Susan G. Komen for the Cure's global headquarters will be giving an overview of the community profiles. And then we'll also be having Gail Brownmiller from the Oregon and Southwest Washington Komen affiliate office to talk about the local perspective on the community profile. So it'll be a great opportunity to learn more about getting information, another source for local information about breast cancer. And if you would like to receive any of our future webinar announcements or any other of our UIHI-related resources and updates, we have a listserv that you can join by going to our website listed here. And there's a subscribe option on the menu. You can pick that. And we try not to hound people, but we do have one weekly email that comes out, and then that includes our webinar information and other kinds of relevant information for those in this audience. Wanted to let you guys know that as you exit the webinar today, you'll have an opportunity to fill out an evaluation on our session. And if you're not able to do it right at that time, there's also an email that will come out a little later today inviting you to complete the evaluation. If you have time to take a few minutes, we really would appreciate and encourage you to do that, to let us know your thoughts and on this webinar so that we can help with the future planning of more webinars. Again, thank you, Ann Larkin and Ginny Furshong, for sharing the information today with us about your programs, and we thank everyone else who has joined us to participate in listening in and sharing other thoughts. So, go ahead.
Yes. Thank you to everybody.
Thank you. Thank you.
Thank you.
All right. Thank you.
Thank you.
Bye-bye.
Thank you.